Well, hello, friends. Welcome to another episode of Intentional Living with Emlah podcast. I am so honored today to have a special friend, very knowledgeable. I think the condition to be my friend is you got to be smart and pretty. I think that's really what it is
You're
because
so
that's
sweet.
how I've had all the people on the show. So typically, your eyes are often called the window to the soul. But what if they're also the window to your health? Today's guest is going to be helping us see beyond blurry vision and the eyes, trying to uncover the deeper connection between eye health, inflammation, lifestyle, and wellness. Dr. Amy Cline is an optometrist with over 18 years of clinical experience, and she's the owner of the Eye Care Studio. Absolutely beautiful practice. If you have not been in there, you need to walk in there. It doesn't look like an eye studio. It just absolutely beautiful. It looks like a museum. It looks like an art show.
That's the goal. Yeah, we have an art studio, like a gallery
Listen,
in there. Yeah.
the Eye Care Studio is a practice known for its elevated and personalized approach to care. While she specializes in advanced dry eye treatments, ocular disease management, myopia control, while taking a root cause approach, and this is the reason why I love her, that looks on how the systemic health and the environment and daily habits impact the eye. And she connects that. So in this episode, we are diving into eye health in a way that you've probably never heard before. From screen fatigue to dry eyes to surprising ways that nutrition, sleep, hormone, stress can affect vision and vitality. So, Dr. Cline, welcome
Thank
to
you.
Intentional Living with Emlah.
Thank you so much for having me.
I'm so happy to have you on here.
I'm so happy to be here.
So, question for you: what made you fall in love with eyes? As a little girl, when did you know that this was what you were going to do?
Yeah, I honestly didn't know until I was in undergrad. I was always interested in medicine, but just never found anything that clicked. And I met someone in my dorm who was pre-optometry, and the light bulb went off, and I said, "Oh, I love going to the eye doctor. Every time I leave, I can see better. It's a good experience. I'm not scared to go." And so I shadowed my eye doctor at home, and I started working for an eye doctor in town, and I just loved it. Everything I learned about it, I loved. The more and more, I learned, I just had all these little rabbit holes I could go down, and I got the chance to have more personalized care with my patients. I get to sit there and I learn about their families and where they went on vacation, and but impact their lives as well in their health journey. So it just stuck as soon as the light bulb went off.
I love that. I
Yeah.
love that. In the most, unlike you said, was that a roommate or just a friend?
A friend in the dorm.
A friend in the dorm.
Yeah.
Just imagine. And that pivoted,
Right.
changed your career,
Yep.
and that's it.
Little serendipity. Yeah.
All right. If you didn't meet that friend, what was it going to be?
I was planning on going into research, mostly like animal care type research. So
I
my
could see
undergrad
you
was
doing that.
zoology, love
Yes.
animals, and so I was planning on doing that. But I would have been miserable like in a lab. I just, love talking to people and having that interaction and that relationship.
Well, we're
So
grateful to that friend wherever you are today. And thank you for making her the optometrist that she is today. So I have a fun question for you. What is one thing that people do every single day that make optometrists cringe?
ooh, there's a few.
I'll take it.
Number one, like that comes
Mhm.
to mind is using redness relief drops like Visine. So
Hmm.
those are vasoconstrictors. So they constrict the blood vessels so you don't see it as much, which does get the red out. But it doesn't treat the root cause of why that redness is there. And it becomes addictive to those blood vessels. So you have to keep using it more and more and more. Your underlying condition gets worse and worse and worse. And then if you stop using it, you get a rebound reaction. So that's like number one that just pops up. But
I was cringing while you were
right?
saying
I
that.
know. So and they have great marketing. Everyone knows if your eyes are red, go grab Visine.
Yes. And it does work
It does.
because of that vasoconstriction,
Yeah.
the redness goes away. So we're
Yep.
like, oh, my eyes are no longer red. I'm fine.
I'm good. Yep.
And
Yeah.
let's get some more Visine the next time.
Exactly. Some more and more and more. And I'd say my second one is just forgetting about our eyes. So, we're
Mhm.
not supposed to think about them. We're not supposed to
Mhm.
feel them. And so
Yes.
just kind of forgetting about them in our whole health system.
So if people's eyes could talk,
Yes.
what do you think our eyes would tell us?
Usually they would say, I need more water.
I
Or
need
I
more
need less
water.
screens.
I need less screens. Okay,
Yeah.
so Dr. Cline, you heard the lady. She said if our eyes could talk, they'll be telling us, Emlah, I need more water. Emlah, I need less screens.
Yep.
So basically just hydrating, just drinking more water through your day.
Yep, helps a ton. Most of us just don't get enough water, or we, are sipping on caffeine all day and, don't get enough of that water. So I like how you just took some.
I
Good
just
job.
took a sip of my water because the doctor said so. Yeah.
Yeah. So yeah, just water all day helps a ton. And
Mhm.
obviously we're all on screens way more than our eyes were ever designed to be. So giving them
Mhm.
lots of breaks is good in many different ways for our whole body, but for
Yes.
those eyes especially.
All right. She said drink more water and less screen time. And that's one of the basic things that we could do to improve our eye health. So before I ask you my next question, I want to take a step back. I assumed something that, many people know the difference between an optometrist and an ophthalmologist. I want to have you give me the difference
Yeah.
between an optometrist and an ophthalmologist for our high school students who are listening and are looking for career paths.
Yeah. So yeah, different paths. We work together all the time, and
Yes.
we co-manage patients all the time. An optometrist will go through undergrad, go through
Yes.
optometry school, so kind of
Yes.
like dental school. It's special for optometry. Generally graduate in 4 years, and then you can go out and do like primary care, we call it.
Yes.
So your routine exams where we're checking vision, we're checking eye health screenings,
Mhm.
managing dry eye, all
Yes.
of your sort of general broad-based things.
Yes.
And then, if something comes up where you need surgery,
Yes.
that's where an ophthalmologist comes in. So, an
Yes.
ophthalmologist track is a little different. They'll go through undergrad, they'll go to med school,
Yes.
they'll do a fellowship that
Yes.
specializes in optometry, or I'm
Mhm.
sorry, ophthalmology.
Yes.
And then they may even do a residency the residency specializes in ophthalmology. And
Uh-huh.
then they may do a fellowship where it specializes even more. So,
Mm.
super, super specialized.
Mhm.
There are surgeons, they handle all surgeries, they handle all really advanced cases that, we kind of can't manage on a primary care level. So
Wonderful.
amazing
Wonderful.
people, yes.
Thank you for giving that distinction. And we have an ophthalmologist who will be coming on the show
Oh, great.
sometime later. But it's really nice to get that distinction because the
Hmm.
average person doesn't know the difference between
Right.
both. It's nice to have that distinction. And then before we get back to the eye,
Hmm.
we talked, you mentioned coffee there,
Yeah.
we're sipping on coffee all day long. So are you a coffee or a tea person?
I like them both, but I
She said, I
really
love them
love
both.
coffee. Coffee is my first love, but I do love tea as well. I'm training myself to love it more and more because of it's so much more beneficial.
I'm a
So
tea person, but
yeah.
either gives us the predisposition to drink less water. So we
Yes.
just need to intentionally remind ourselves to drink more water
Yep.
all
I
the
tell all
time.
my patients if
Hmm.
you're drinking for every cup of caffeine you have, you should have two
Yes.
cups of water. One to replace what you would have been drinking
Hmm.
when you drank that caffeine, and then one to make up for the dehydration that the caffeine gave you.
Oh, she's strict. Can you say that one more time, please?
So for every cup of caffeine you have,
Uh-huh.
you should have 2 cups of water to balance it out.
Prescription
So,
from an optometrist.
yeah.
Who knew that? Who knew that? You were all tuning in today thinking you were listening to eye health stuff. But she just said for every cup of coffee you drink, you're going to drink 2 cups of water at least to
Yeah.
make that. I
Yeah.
love that. And all of your body is benefiting from that hydration.
Absolutely.
So many people complain about dry eyes now.
Mhm.
So why is this becoming so common?
There's a lot of different reasons. So, one, we're just know more about it. So we
Yes.
are
Mhm.
able to diagnose it a lot
Mhm.
better.
Yes.
We're able, patients are just more aware of it. And a lot of our just lifestyle changes are
Yes.
adding to it as well. So hydration is a big one with it.
Yes.
Our screen time is huge. We don't blink our eyes as much as we should.
Mm.
Generally, we should blink about 20 times a minute. On a screen, we blink about 7 times a minute. And that blink is what resets your tears that help keep you hydrated. They keep you, they're the only way our eyes get all of our nutrients. So our antibodies are in there. All of our nutrients for the surface of the eye are there. So if we're not refreshing that, our eye can't stay healthy. So that's
Oh
a
my
huge
goodness. You guys
one.
should see my face right now. Wait, you just said let me make sure I got this clearly.
Yeah.
You said we should normally be blinking about 20 times per minute.
Yes.
But when we're on a screen, we blink only 7 times a minute.
Yep. Yeah.
And blinking is what resets your eyes, like the tears.
Yeah. So it's if you think of it kind of like a windshield wiper, when you blink, it kind of resets the tears on the surface, and that there's so many good things in there that we need. Because we don't have blood vessels on the surface of our eye. That's why we can see, because it's clear. So it's the only way that we get nutrients, we get antibodies. It's our whole immune system. Everything is there. So when we aren't blinking, we're missing out on all of that.
Oh, girl, I mean, this is why I talk about having smart friends in different fields. I just learned that, people. And this is the reason why screen time is really not good for us. We have so much increased screen time, and that's what's causing that dry eye.
Yep. Yeah.
One of those reasons.
Yep. Lots
Even
of
more
other
compelling,
reasons.
lots of other
Yeah.
reasons.
Yep.
So now dry eye. Let's talk about the non-pharmacologic options.
Yeah.
So before we get to prescriptions,
Yep.
what else can I be doing to help dry eye?
So luckily there's lots of things that we can do. The sort of the root of dry eye, the symptoms that we get comes from inflammation. So if you think of, right, it's just like everything else with our
Yes.
health. So if you think of anything in your lifestyle, in your diet that is causing inflammation and you can minimize it, it's going to help your eyes. So our diet, our gut health is huge, leaky gut and any inflammation there.
Do you see why I
difference.
love her so much? This is the reason.
Yeah.
Inflammation is the root of all evil.
It sure is. Yeah. So yeah, if we can get rid of anything there, cleaner diet, movement in our lives, reducing stress, which is always hard, but if we can do that, those make a huge difference. Just lifestyle changes alone can make a huge difference.
Do you see what Dr. Cline just did there? She just listed the pillars of intentional living and said those are going to help if you focus on that and intentionally prioritize those will help your dry eye. She said putting nutrient-dense foods on your plate, anti-inflammatory foods on your plate. That will help reduce inflammation, and that will reduce dry eye in turn. If you're moving your body, that will reduce inflammation, and that will reduce dry eye in turn. If you're reducing stress, that inner alignment, that positive social connections, do you see how all those are connected?
Yeah.
That's crazy.
Yeah.
And she first of all started with telling us much about drinking water, and that's helping the dry eye, and then reducing our screen time.
Yep.
I see what you're doing here. You're giving us all the tips on non-pharmacology. You haven't even talked about any prescription yet.
Yeah, yeah. And that's where I usually start is I like to start nice and simple. A lot of times we can make lifestyle changes, diet changes, some small little things at home, and it can make a big difference. And then we don't have to go to, medications.
All the way to the medications.
Yeah.
And then when we come to the medications, I'm going to have you talk about the medications a little bit, but then I'm going to save my favorite supplement for dry eye to the end of the show, because you have sent so many patients to the pharmacy to come pick it up, and they're like, oh my gosh, I feel so much better. I never knew that this helped until my optometrist sent me here. They just walk into the pharmacy looking all confused and like, my optometrist sent me here to pick up. I'm not going to talk about it till the end of the show. But what prescriptions do you usually write for? What do you usually recommend for dry eye?
Medications.
Medications-wise,
so even before we jump to medications, what I really recommend are some light and heat therapies that we can do in office.
Tell me more.
The light therapy is called intense pulse light. They've used it in dermatology for about 30 years for inflammation on the skin. And where a lot of the inflammation that we're seeing causing the dry eye is coming in our eyelid. So we've got these tiny little glands in there. They produce oil. And when we have inflammation, they can't produce oil. We can't make good tears. So if we can get that inflammation out of the way, and then we heat up those glands just to get them working better, that takes care of 80% of cases without even having to go to medications. So I love that because it really gets to the root of what is causing all the issues, aside from, if we can address gut issues and things like that too. But that makes a huge difference. And then patients don't have to take medications every day, and they feel better. They look better.
Love that.
Everything's great.
I love that about you. So what is the name of that therapy again? Tell me.
Intense pulse light. It helps the inflammation. And then we use radio frequency, also used in dermatology, for the heat part of it. It kind of heats those glands up.
And we will have a link in the show notes to the eye care studio, which is your practice.
Yeah.
We'll have a link to your Instagram. We'll have a link to all the things if you would like to see Dr. Cline, because I absolutely love the way she practices with that intentional aspect of root cause first, instead of just putting a little Band-Aid on it and giving you Visine, because we know she's not giving us Visine now. We know that already.
No Visine, no.
She's going to go to the root cause and figure out a way to reduce that inflammation so that we can improve our eye health.
Yeah.
So I can't even, what are some of the other signs of dry eyes that people often ignore? Like, what other signs are there?
Yeah. So most often, and I will say that dry eye is kind of a misnomer. A better term would just be ocular surface disease or tear film abnormality, because a lot of people don't actually feel dry. They have plenty of watery tears, which they'll come in there, they'll say, nope, I don't have dry eyes, my eyes water all the time, I don't have a problem. Like, well, you got plenty of the watery tears, but we don't have that oily component. And so sometimes you don't feel dry. Sometimes it's just a fluctuation of vision. If you are on the screen, or maybe later in your day you feel like you kind of you have to blink real hard to get things clear. Sometimes it's just light sensitivity. You get a lot more glare with nighttime driving. Sometimes it's just eye strain in general. Lots of different things that we don't necessarily equate with feeling, quote unquote dry.
Let's take one step back to nutrition. What's your favorite eye healthy food?
Ooh, salmon is great. Like, fatty fish is great.
Salmon, yes.
We'll talk about that in a minute. That's fantastic. Nuts are great. Anything with a lot of omega-3s in it, anything that's anti-inflammatory or antioxidant. So I always tell my kiddos, because they're a little resistant to eating healthy.
That's all the children,
if you see anything bright and colorful on your plate, you should gobble it up, because it's going to help those eyes, because it has the antioxidants. So berries are fantastic. A lot of times they'll go for a sweet potato. I try to tell them all the stuff that they like. Be like, that's good for your eyes. Just gobble it up. So all of those
I love that. If you see anything bright and colorful on your plate, you should gobble it up, because it's good for your eyes. It's good for inflammation. That's a cute way to tell it to the children, because that is true. I think we as adults need to hear that too, please.
We do.
Thank you.
We sure do. Yeah. But anything that I always tell my adult patients, anything that's heart healthy is going to be eye healthy. If you're taking care of your vascular system, you're getting those nutrients. Our eyes are so vascular, and we need all those nutrients. So that's all good too.
So my daughter asked me, so I told her I was having you on the podcast today, and she said, Mom, would you ask her if blue light glasses are really worth it? Saying that, and she was wearing her blue light glasses, and she was like, can you ask her if blue light glasses are really worth it? Because my friends were saying that it doesn't work.
Yeah.
This is my 14-year-old daughter.
That's okay.
And she wants to know.
Question every single day.
I got some for her, but she wants to know, because she wants to tell her friends.
Yeah. So I will say that they really work sometimes for some people. Just right. That's your typical answer. So we get more blue light exposure from the sun when we're just walking outside. So sunglasses are great, because they help with that. They help with UV. Most computer screens and phone screens have some sort of blue light filter on them already. So it doesn't make a huge difference. That being said, someone who is really susceptible to eye strain or migraines, it can make a huge difference, because it just cuts down that extra glare, that extra strain, and can make things more comfortable for them. So sometimes is my answer.
Sometimes is your answer. This podcast is sponsored by Journeys, your path to intentional wellness. Are you feeling fatigue, brain fog, low energy levels, and suspicion of inflammation? Most health problems don't start overnight, and neither does wellness. With Journeys, you can take charge of your health before you have to. Every cell in your body is whispering to you. But when we ignore preventive medicine, we wait until those cells are screaming. Journeys helps you listen to the whispers. There are 3 different lab test bundles to choose from. Starting at $199 up to $479, we measure up to 125 biomarkers, most that are typically not measured at your annual wellness visit. Normal labs is not a diagnosis. We get the most complete view, including hormones, nutrient markers that support energy, balance, and healthy aging. Each journey includes a personalized recommendation, one-on-one care from your pharmacist, and follow-up support to turn results into lasting intentional change. It's more than data. It's guidance, accountability, and a partner in your wellness journey. Intentional living means paying attention, staying curious, and taking steps towards the health you deserve. Start your journeys today. Click the link in the show notes. I don't know that she would really like that answer. She was looking for a sword because she's got ones with really cute frames
They
and
are
everything.
really cute.
So
They don't hurt. They don't
Okay.
hurt her eyes, so
as
she
long
can
as they
keep
don't
wearing
hurt.
them.
Okay. All right, lovely.
Yeah.
All right, they don't hurt. So, what is a simple daily habit that everyone can start today for healthier eyes?
Other than drinking water.
Other than drinking water, you've already given us that. I feel like I've asked this question in multiple ways.
That's okay.
Yes.
I would say getting good sleep is huge. So,
Who knew?
yeah, I know, right?
Yeah.
So, one,
Mhm.
our eyes need that time to be closed to heal overnight. So they're open and exposed. They're working really hard for us all day.
Yes.
And we need that time to heal. Our whole body does, but our eyes really do. So if you're
Never
waking up
thought
in the
about
middle
it
of the
like
night,
that.
if you're running by on 5 hours of sleep,
Yes.
those eyes are going to pay the price. So that helps a ton.
I didn't even think about it that way.
Yeah.
They're open all the time. They're helping us, and we
Yeah.
need to rest them.
Yeah. Give them a little break.
So when we think about the importance of sleep, which is ultimate, like just optimally important, we don't even think about how much the eyes need sleep.
Yep. Yep.
Poor eyes. You already told me
Just
so
don't
much
forget
about
about
this
'em.
info. I know info. We just keep forgetting about them. I mean, because they're
Yeah.
just so, they're just so there,
Yep.
And contacts or glasses.
Ooh, so I personally wear contact, or I'm sorry, I
Mhm.
personally wear glasses because my eyes are dry.
Mhm.
That's a little bit of how I kind of got into this whole world.
Yes.
But they're both great. They're
Mhm.
fantastic. I love, love, love the freedom that contacts give patients to not have something on their face when they're doing physical activities. If they're outside, they can just throw a regular pair of sunglasses on. But glasses are super fun, and quite honestly, your vision is always sharper and crisper with glasses than it is contacts. So I can't decide. That's like choosing your favorite child. I can't choose between those
Oh,
two.
she can't. She can't because if you go to her office, you're gonna see all these fancy styles of frames. I feel like you're
We
the
have
queen of
lots of
frames.
fun. We have lots of fun. That's our biggest goal when we're picking out frames is to pick out something that is going to make someone smile when they put it on. So no boring frames allowed.
Yes.
Nothing that's going to be like, oh, I have to put these on again.
No boring frames
Yeah,
allowed.
you have to smile when you put them on. So
I
that's
love
our
that.
goal. Yeah.
Tell me a little bit more about the eye care studio. I like that. No boring frames allowed at the eye care studio.
Yeah. So
Tell me a little bit more.
are
What made you open that practice? Yes.
Yeah, it was a project passion basically. So I always wanted to have my own practice, and I was working as an associate for quite a while. Quite honestly, getting burnout. I was doing routine care, meaning kind of just like glasses prescription, regular screenings, and not getting to get into like the meat of all the medical
Mhm.
components. So I was getting close to 40, and I said, well, if I'm going to do this, I better do it sooner than later. And so I just decided to take the jump, and it's been amazing. It's, obviously stressful sometimes and challenging, but it's been so fun because I get to challenge myself every day to like just learn as much as I can to provide as much as I can for that medical care for patients. Our goal when patients walk in is for them to feel like you're just coming over to our house for dinner. If you walk in a friend's house and you're like, "Oh, I love you. Like, thanks for coming."
Yes.
That's our goal. And we just want to make the community better. We want to make our patients' lives better. So yeah, that's how it came out.
And you do that so well. You are so
Oh,
welcoming, and it's
thank
just
you.
being with you. Just being with you on this podcast is like you and I just hanging out.
Yeah.
And I do love that about you. How passionate. If you're looking for a good optometrist who doesn't just take a look at the eye, who goes to the root cause, you should be connecting with the eye care studio. We're gonna have a link in the show notes below there, and a link to how you can get in contact with her. But this is time for my favorite part
Yeah.
of the show, and it is supplement school with Emlah. And remember, there are no exams in this part.
Thank you.
So today we're gonna ask Dr. Cline what supplement is on your mind.
So my favorite supplement, as it relates to the eyes, are omega-3.
Omega 3s. We saw that coming. Ding, ding, ding,
Yeah.
ding, ding. All right, tell us why.
So they just have a huge impact all parts of the eye. So
Yes.
they're anti-inflammatory. Our American diet is not great at anti-inflammatory, so it helps
Yes.
balance out some of the things that maybe we shouldn't be eating.
Yes.
For our eyes, it's great for the tear film. It's incredible. It's great for our vascular system,
Mhm.
which is kind of like I mentioned earlier.
Yes.
Our eye is so vascular. Some of the smallest blood vessels in our body are
Yes.
in our
Yeah,
eyes.
eyes, yeah.
And that's why it's, they're so impacted by blood pressure, diabetes,
Mhm.
cholesterol.
Mhm.
And so it helps with all of that. And they're good for hair and skin and nails and all of that too. So
All the
all
things,
around,
all the
yeah.
things. It's every time, when people see fish oil, the first thing that goes is cardiovascular disease. Yes,
Mhm.
cardiovascular disease. You are almost correct. Very correct, though. But the omega-3 will help improve vision,
Mhm.
joint health,
Yes, I
hair,
didn't mention joints.
skin,
Yeah.
nails. It is just all around. And this is my line. When you said that, I had this huge smile on my face because you know that if you hold an omega-3 and you hold a multivitamin and say, Emlah, you can only have one, I'll be like, it's such an easy decision. I close my eyes and pick the omega-3 every single time.
Yeah.
Because omega-3s and omega-6s, we talk about omega-6s or omega-3s all the time. We forget about omega-6s. We need a little bit of omega-6s, but we don't need as much.
Right.
The standard American diet, like you said, makes us eat so many omega-6s. And the ratio of omega-6s to omega-3s in our body is like, right now with the standard American diet is 20 omega-6s to 1 omega-3. That's how much we're getting on the average diet.
Yeah.
That's how much we're getting. But that ratio, in order to be really healthy, that ratio should be 4:1. Just think about that.
Yeah.
But we're not consuming enough omega-3. So we need to figure out how many people are eating fish as
Right.
much as we should be.
Right.
How many people are eating those nuts you talked about as much as we should be. So it's really important to, at least to me, Ronnie as my pharmacy manager, and for her, everybody should be on an omega. For me, everybody should picking a vitamin D. For Ronnie, everybody should be on an omega-3 because she would list the benefits. She has like 10 benefits of omega-3s.
I love it. That's
I
amazing.
love that. I
Yeah.
love that. I'm so glad that you had the time to come spend with us today. We have learned so much from you today. And if you have benefited anything, I have learned things that I didn't know. The blinking part, I'm so impressed by. Wait till I share this. And this is really a best thing. We cannot hide knowledge within us. You went optometry school, you learned all that stuff. We were not there with you, but now we get to learn from you by you being our optometrist. So if you have benefited from this podcast episode, please share it with friends, family, and relatives that will benefit and learn more about taking care of their eyes, because she said our eyes are open all day long taking care of us, and we just ignore them.
Yeah, we just need to give them a little love.
We need to give them a little love. Give love to your eyes by putting nutrient-dense foods, drinking water. You heard her. Drink water and taking omega-3s and going to Dr. Cline's office so she can take good care of your eyes, because we don't want all those eye diseases. I feel like we should have you back on the show because there are lots and lots of things that I wanted to talk about. Other eye disease, macular degeneration, glaucoma, other things that we could talk about. I feel like those are full episodes on their own.
Yep, I would
you
love
agree?
to. I would love to. Oh, yes, I could
Did you
talk
guys
for
see what I did
days.
there? I just snuck in an invitation. Well, thank you so much for spending time with us today and listening to Intentional Living with Emlah. Please share this episode on Apple Podcasts, Spotify, and YouTube. Thank you, and continue to live each day with gratitude and intention.
Thank you so much.